I'm Dr. Schuler, and we're just going to go over the basics of chiropractic and our office services and how you can get the most out of our services to get you as well as fast as we can. Because the more educated you are, the faster you get well. So, we know that research shows that making lifestyle changes like diet and exercise and the way you think will improve your overall health. But the question you're thinking about when you're going to the chiropractor is if there's a spinal misalignment called a subluxation causing nerve interference to your nervous system. So, and if you have one of those, how can you correct it? How can you get it to improve your health? So, I'm going to just go over our goals at chiropractic, our goals here at Back to Life Chiropractic. So, our first goal is determining if there's a spinal misalignment that's called a subluxation as a possible factor affecting your health. So that's our first goal, just to find where you might be out of alignment. Our second goal is to determine your overall health score. So unless you have a score along this scale here, you don't know if you have a health problem or not. We're going to go over that in a little bit. And our third goal is developing a treatment plan based on your goals to improve your spinal alignment and your health score. And then our fourth goal here is treating your spinal misalignment, which is subluxation, through chiropractic adjustments, monitoring your overall health score, and providing services that improve your health through lifestyle modifications. And then our fifth goal is to help others get back to life. So after you get better, then it's good for you to turn around and try to help someone else. And that's our goal here too. So one of the attitudes is sick care versus health care. So most Americans, when you feel great, full of energy, and have no symptoms, do you wake up thinking, man, today I should call my doctor. So typically you only call your medical doctor when you're sick or feeling poorly. But sick care is very important in a time of crisis, but it has nothing to do with health. And that's what we're going to go over here, is that attitude. So your attitude is that drugs are the answer. So, if you have a headache, what do you take? Aspirin, ibuprofen. If you have high blood pressure, what do you take? Take blood pressure medicines. If you have cold, what do you take? Antibiotics. If you have pain, what do you take? Take hydrocodone or ibuprofen. If you have gastric reflux, what do you take? Keep doing that. If you have poor circulation in your legs, what do you take? If your stomach hurts, what do you take? Take the purple pill. If you're depressed, what do you take? Take Wellbutrin and other medicines. So, Americans, when they have a problem with a certain symptom, then they take a certain drug. So, now how is that attitude working in America? So, the third leading cause of death in the United States is the drugs that we're taking and the medical care that you're getting. So, this is an article from the Institute of Medicine report from JAMA. It got into American Medical Association, JAMA, and it's saying that 250,000 deaths per year from iatrogenic causes is the cause of death in the United States, which is behind cancer and heart disease. So this was a couple of years ago, so this could be even more now. So the attitude that drugs are the answer might be wrong, because if it's the third leading cause of death in the United States, then that might be a problem there. So do you know where the World Health Organization currently ranks Americans' healthcare system? So there's 1 through 36 right there. So 37th. The United States of America is 37th ranked in healthcare behind all these other countries. So definitely there's something wrong there with the attitude that medicines are going to take care of our problems. So now we're looking at the scale again. We were talking about that a little bit earlier as one of our goals, was to figure out where you are in the scale. So, wellness is optimal health, 100% function, continuous development, active participation in wellness lifestyle. So when you're in this area, everything's functioning well, you're not taking any medicines. Then you have good health, which is regular exercise, good nutrition, wellness education, minimal nerve interference. Next is false wellness. And this is where most people start out as. You have no symptoms, but your nutrition is inconsistent, your exercise is sporadic, and your health is not a high priority. And then poor health is symptoms, drug therapy, surgery, losing normal function. Things you're having some symptoms off and on, taking some drugs, maybe getting surgery. And then disease is multiple medications, poor quality of health, potential becomes limited, and your body has limited function. So that's the scale. That's one attitude of sickness, healthcare, and that's wellness, healthcare. So where would you say that you're on the scale? And which way do you think you're moving? That's the question, because you're always moving one way or the other. So one's toward illness, and then one's toward wellness. So what we're going to talk about, eventually, we're going to talk about in this lecture is like, how do you come up with a health score to come up with that? And that's one of the things we do at Back to Life Chiropractic. So the purpose of pain. So we want to talk about pain because that's why most people are here, starting out as chiropractic patients. They actually are having a symptom of pain. But pain is not necessarily a bad thing. It's just pain is something that your body is communicating with you. It's kind of like, it's like an argument. Your body's telling you maybe you shouldn't be doing certain things, you need to change certain lifestyles. And so, what you need to think about is what is your body trying to tell you and what is the cause of your pain. So this is a nice poster. I like this poster. It's a picture of an iceberg. But your pain is only the top of the iceberg. What's underneath is probably the cause of your problem. So pain is just a small indication of how big your problem is. So the role of the nervous system. The nervous system is the master control system of all functions of your body. We live our lives through our nervous system. What you see, hear, touch, smell, taste, and think all happens through your nervous system. Everything is controlled by your nervous system. Every function of your body, heartbeat, athletic performance. So the nervous system is a self-healing mechanism, and that's the one big thing that's different with chiropractic is we believe your body is a self-healing mechanism and that your nervous system is the master control system of your body. So if you interfere with the nervous system functioning properly, then you're not going to heal right. So chiropractors call this interference of subluxation. So that's a misalignment of your spine causing nerve interference. So we're going to go through the development. So here we go. This is two cells. And then you're going to see that the first thing that forms is your brain and your spinal cord. That's the first thing, because your brain and spinal cord is what produces all the organs and all the functions of your body. So look at the big brain there, spinal cord. So the first thing that grows is the brain, and then the life impulse comes from brain. But unfortunately it has to be protected by bones because it's so delicate. So you make a skull, and then you have vertebrae, 24 vertebrae, and then the nerves are coming out of these vertebrae, and they're just like delicate nerves like that. See all these different nerves? There's different types of nerves going different parts of your body. So as a chiropractor, we know that when your vertebrae are all lined up, then the nervous system is functioning properly. And then when your spine is not lined up and the vertebrae out of alignment and subluxated, then you get an interference that doesn't allow your nervous system to function as properly. So, and then here's a nice picture of this old chiropractic where you have a light bulb. There's two light bulbs. So when you have lack of nerve flow, so you're going to have less energy going to those cells and tissues. That light bulb is not going to be as bright. And that's one that the nerve flow is going through. So what we have here is this little thing on the right is called an energy ball. So what I'm going to show you is that your body is kind of like electricity. So what we have here is an energy ball. And so what I'm going to do is I'm going to put electrical current, because my body will make this into a current and make this little energy ball work. So it's kind of like a cell of your body. When this becomes disconnected or misaligned, see how you're not going to get enough electricity to your cells, not enough nerve impulse or life force. Then when you get irritated, so there's a lot of little fun toys like this. That's one of them. We're giving you this tonight for coming here tonight. And we actually have Rosie doll. Likes to sing Ring Around the Rosie because she's based off our electrical current.
Ring around the Rosie, pocket full of cups. Ring.
So our bodies are like electricity, the nerves are. And when these come misaligned, then your body starts to talk to you, producing pain, and we just kind of ignore it. So there we go. That's Rosie. So nerve interference to a nerve. Only 60% of nerve interference causes interference to your nervous system, causes symptoms, and then disease, and then the subluxation comes first. So here we are. So the nervous system needs to be in balance, and so the reds are parasympathetic, the blues are sympathetic. So your nervous system tries to be in balance, and so the reds slow you down, and the blues speed you up. So you need to keep this in balance, and so depending on what part of your spine is out of alignment, depends if your body's working too well or not working well enough. It's like either making too much nerve flow or too little nerve flow. And each of these things controls each of your organ systems. And so the nervous system, the digestive system, the muscular system, the circulatory system, the glandular system, and the eliminative system are all systems that need to be in balance. And so you can see where if you have subluxation causing the lack of nerve flow, then you're going to get out of balance and cause different problems in different parts of your body. So that's chiropractic, and that's how, if we can just adjust you in these areas and get that balanced out, your body will start to heal itself. So, for example, as we were talking about, so let's say you have headaches. Well, headaches is up here. So, instead of giving you medicine, we're actually going to adjust this vertebrae, let your body heal up, and let the nerve flow, the electrical impulse go to those areas, and let your body heal up. And that goes with everything else. The stomach troubles, back pain, low back pain, gas pain, sinus troubles. I mean, anything that a nerve might be not going to that system and not function properly will cause those symptoms. So the weight of a quarter causes 60% nerve interference. So only a little bit of pressure on a nerve can make a big difference, and just a little bit of pressure off a nerve can make a big difference. So you might ask yourself, what causes a subluxation? So a subluxation can be caused by auto accidents, falls, sports injuries, trauma, repetitive movements, poor posture, chemical stress, emotional stress, nutritional deficiencies, the birth process, childhood falls, and accidents. So it's a whole gamut of things that cause you to get nerve interference to become subluxated. So it's usually a combination of these things that will get you subluxated. And then for me, accidents happen. I got hit by a TARC bus when I was a freshman at Hanover College, and it ripped everything from my low back and knees, and I took blood thinners and pain pills and laid in bed for months and months. I was supposed to get surgery. Elected not to get surgery. My mom took me to her brother, who was a chiropractor in Sellersburg. He adjusted me. I was able to walk again and move again without any more. I didn't have to get drugs or surgery, and so I just thought that was a great experience. So I decided to become a chiropractor. So sometimes just a bad accident can get you out of alignment too. So there's a picture of me, my bus wounds. The longer you've been subluxated, then the longer it's going to take you to get well. And so that's just a chart showing you that. And then as you slowly start to get these things back in alignment, your subluxations, then the healthier you're going to get. So what's next? Lifestyle changes. Why? Because stress happens. So we're going to talk about stress. So here's a nice explanation of stress, which might be stressing you out, because either you might be going too slow or too fast. But certain things cause you to have a stress response. They can be positive or negative, but they cause you to have stress. Your body reacts to them in both ways. So we'll let this finish up. So there we go. Stress happens. And so when stress happens, your sympathetic flight-fight mechanism of your body kicks in, and you get revved up, you're edgy, you have inability to relax or sleep, you have constriction of the arteries, increased heart rate, blood pressure. Next, the nerve supply to the gut is decreased and the peripheries increase, so you get decreased digestion, acid reflux, bloating, constipation, irritable bowel. The nervous system decreases reproductive hormones, you get sexual dysfunction and lack of drive. The pituitary decreases growth hormone, you get inability to build muscle. The adrenal glands release adrenaline and epinephrine and cortisol, which cause increased blood sugar, hypoglycemia, and diabetes. So then you get cortisol, causes the liver to reduce HDLs, increases LDLs. So you get high cholesterol, increased cardiac risk factors. This increases cravings for sugar and for fatty foods. And then your adrenal hormones stimulate the amygdala, which is the emotional center of the brain, to call on previous memory. At the same time, logical thinking centers are inhibited. So you get symptoms like difficulty remembering and learning new information. Cells of the hippocampus have actually shown to shrink. Your adrenal hormones increase sense of touch, smell, hearing, and sight. You get easily distracted, poor attention, increased sensitivity, and heightened pain perception or fibromyalgia. So what we see here is the flight-fight mechanism actually will decrease sleep, and shortening even one night of sleep by 4 hours causes a significant reduction in insulin receptor sensitivity, which leads to high blood sugar, type 2 diabetes, syndrome X, heart disease, obesity, cancer, and chronic fatigue. So in short-term stress, serotonin will be released to inhibit the release of non-adrenaline to help stop the stress response. So however, in chronic stress, serotonin production cannot keep up with resulting depression, fatigue, and trouble sleeping. So it inhibits your serotonin, which is your happy hormone. So then it inhibits that, and then you start having this bad news right here. So the bad news is when these pathways are fired up in the spinal cord and brain, they become more efficient in processing them and allowing your body to move into stress physiology more quickly and effectively. So the good news is the stress response can be shut up. And the way we do this is by making lifestyle changes. So we're going to show you how proper lifestyle changes can be made with Back to Life Chiropractic and connected to Wellness Get Fit program. So we have a whole program based on making lifestyle changes and reducing the stress cycle and counting it. So, and this is what I was just talking about. This is a nice graph of it. So there's the good things we just talked about, and there's the bad. I'm not going to go over it all again. Here's the effects of stress we just talked about. Gastrointestinal system problems, irritable bowel syndrome. A lot of people have that, constipation, ulcers, Crohn's disease, impaired immune system. So the big question is, how do we know if we have subluxation that can be affecting your health, and what lifestyle changes do we need to work on? So one of the things I like, and that is a good indicator of subluxations, is x-rays. So here we see a spine that's reversed, anterior weight bearing of the head, has some arthritis, so we know this person's subluxated in the lower spine, too much motion there. These aren't going back into a curve, so we know that this person's subluxated in the neck. This one here is a bad arthritis, and we know they've been subluxated for years and years. So they're getting a lot of nerve interference, no curve in the neck, anterior weight bearing. Here we see the femur heads are off, so we know their hips are out, their SI joints are out. We know the L5 is rotated. So x-rays are a good indicator of where you might be out of alignment. And then we can actually grade your subluxations and see what stage of degeneration you're in. So we also have the Insight Subluxation Station. It's a testing system to see where your nervous system is. It's based off of thermography, which is your skin temperature, which is affected by your nerves and glands, your body. The surface EMG is the muscles, and we have range of motion. That actually will give you a health score. Then we actually have reported findings, and we actually rate your subluxation so you can grade it and see how you're progressing. Then with the lifestyle changes, we actually have a health score. We have a master score sheet that goes over the 7 essentials of health, and it has different tests that you're going to do throughout your care. That's going to give you a wellness score, and then we know what areas you need to work on. So when we have your reported findings, we go over the vertebral subluxation complex and where it is and where nerves is causing problems with. And then we have lifestyle recommendations based off the little tests that we do: nutritional, cardiovascular, strength, flexibility, posture, nervous system, and arches. And then we have services at our office that will start to work on this and correct this. So that's what we're going to go over now. But there's the reported findings you're going to get. Tells you your visits and long as it's going to take in each area: crisis, the wellness, false wellness, and then into the prevention. It's going to give you a vertebral subluxation score, and then it's going to give you the lifestyle score in all these different areas. So the reds right here is the area. These are the services that we have in our office at Back to Life Chiropractic that are going to help this area here. So in the lifestyle recommendations, nutritional, we have the Zyto, which is it's a machine that reads your galvanic skin currents. It tells you which systems and organ systems are out and which supplements you need to take. We have pH. We're into pH balance, which we can see how your chemistry is affected. And then we actually go off your symptoms here, which is called the balancing body chemistry, and it's a symptom sheet that tells you which supplements and organ systems are out. So we cover the whole basis here. We have symptoms, chemistry, and we have current of your body, which we know is really important based on the Powerball example we showed earlier. And then next is posture and arches. So if your posture is out, then you're always going to have strain on your ligaments, muscles, and on your disc. So one of the things we can do is scan your foot. We have a 3D foot scanner. And then if your arches are out, it'll show us how your hips will come low, your knees rotate, and how your posture will be off. So the vertebral subluxation complex, everything helps that. You have to do everything in order to help your subluxations: nutritional, cardiovascular, strength, flexibility, posture, nervous system, arches. So getting adjustments actually helps all these different areas right here. And then there's all different types of techniques that I use in the office. I do Diversify, Thompson, motion palpation, Gonstead, Logan, Activator, applied kinesiology, SOT, biophysics, Schofield, Nemo, Cox, Palmer, Diversify 2. What a lot of people don't realize is chiropractors elect and learn different types of adjustments. And so each chiropractor is a little bit different in the way they adjust. And so I chose a whole bunch of different techniques that I like. Some are a little bit more manual and more physical, and some are more light and easier on the body. You don't have to rotate the head. So there's a different technique for everybody, from infant to someone who's 100, which has been the oldest patient. So then we have strength training. We can work on the strength. We have the Synergy system, and we actually have personal trainers at our office. And then for the muscle problems, the histopathology, we actually have the laser with E-stim, which is another nice tool that we have in our office to help those areas. And then for myopathology and flexibility, we have the intersegmental traction tables, like massage table, and we actually have massage therapy. So to review, secret number 1, sick care is not health care. You must know the difference. Secret number 2 is pain, although unpleasant to experience, is a necessary biological process for survival and alerts us to the fact that something has changed. Secret number 3 is the nervous system is the master system of our body, controlling all perceptions and functions. We live our lives through our nervous system. Number 4 is the vertebral subluxations are a sign of interference to the nervous system and our primary focus of chiropractors. They can disturb the function of various systems of the body, reduce health status, and uncorrected can lead to a serious decline in health. And number 5 is lifestyle stress in 3 dimensions. Emotional, physical, and chemical causes negative effects of your nervous system and cause vertebral subluxations. Number 6 is that chiropractic has a vision and has new technology and has new systems more than ever before, and that our passion is not just to help you with your pain, but actually help you modify your lifestyle symptoms, get you out of the stress cycle, and get you healthier. So, important policy in our office is that, if you know that these subluxations be causing nerve interference to your body, causing you not to be healthy, then why would you want to leave your friends and your children behind? So we actually will screen anybody's kids, our family members. So we'll actually give you a certificate for that when you first come in, or if you ever want one. So that's just one of our policies, especially children. I've adjusted my children since they were born. I adjusted them like a minute or 2 after they were born, and I've always checked them ever since. And we do always see a lot of kids in our practice, and it's a great thing. So Americans will spend $2.6 trillion this year on healthcare, and that's $8,300 per person, or 18% of the GDP. So this means a family of 4 will spend an average of over $33,000 this year on healthcare expenditure. So one of the things that you might think in the short term that spending a little bit of money here might be tough on the budget, but in the long run, if you're always living in sickness, then you're always going to be spending more and more money. So the best way to save money for your family and to help the community is by getting well. And so, if you're having a lot of problems, and you've had a tough time, we do have a whole Get Fit program that has, it's a personalized test. It has blood work. It has all the different score sheets. And then we take that score and then we actually make a plan for you to teach you a habit. And so the Get Fit program has massage, personal training, chiropractic, nutritional program, all here at the office. And in 3 months, then you would take another test again. And that's something, if you're interested, you can talk to me later. We actually have more workshops here. One is just how to come up with a health score. So if you have anybody that might be interested in that, then bring them in. Those are every Wednesday. They change a little bit, but they're always on Wednesdays. It just depends which workshop it is, and we have those events on our website. Then we have the cheat sheet of health. This is like all the things that you need to do to be healthy based on your wellness score. And so it's a nice workshop that just helps explain what you need to do. It's on a little checklist. It's very nice. Came up with that years ago. So, and then we actually have 2 community things that you can help your community. One is the Get Healthy Game. It's based off the Get Fit program and these workshops, and it helps you come up with a game where you can push yourselves and get healthy, and then actually win prizes. If you're interested in that, I can give you more information on that. And then we actually have a church program called Weighing for the Great Commission. It's just a way to get healthy and raise money for missions. And so if you're ever interested in that, just let me know. More information on these things is on our website. It explains a little bit more, but we're just running out of time. So, and then we actually have a Connecting to Wellness coaching program. If you're just having difficulty and you feel like you need a little bit more, we have a program where we can actually help you in all these areas. So if you're ever interested in that, just let us know. So for coming tonight, we're going to give you a chiropractic wellness exam and score certificate. And then if you want any more information or coupons, like us on Facebook, and that'll tell you what upcoming events and any kind of deals we have. And then if you go to our website, we have a free newsletter, and we have a lot more information about our services. And then you can download our website from the App Store. It's called Back to Life Chiropractic KY. So that way you can keep your knowledge and education going. And we have a lot of videos on all the things that we just talked about too. So and just real short. So there's 2 attitudes: illness to wellness. And so our goal is to get you from looking like this car to that car. You might get from A to B, but do you want to go in that car or do you want to go in that car? And so chiropractic allows you to function at your highest capability and function at your best. So for coming tonight, we're going to give away a free massage, or if you watch this on video, just tell us, email us, tell us you've watched the video, and we'll post you in a drawing for a massage.